Today, we're shedding light on a crucial issue that may be silently affecting your health: diabetes. This long-term condition arises when the body struggles to manage blood sugar levels effectively. The early signs can be so subtle that many people remain unaware they're affected, often mistaking these symptoms for other conditions. In today's video, we'll reveal 20 potential indicators that you might have diabetes without realizing it. Pay close attention, and if any of these symptoms seem familiar, it's vital to consult a healthcare professional immediately. Let's explore this further. What leads to diabetes? Diabetes occurs due to complications with how insulin is produced or used within the body. In type 1 diabetes, the immune system mistakenly attacks and destroys the pancreatic beta cells responsible for producing insulin, which is crucial for blood sugar regulation. The precise cause of diabetes remains unclear, though a combination of genetic predispositions and environmental factors, such as viral infections, could trigger the condition. In type 2 diabetes, the body either becomes resistant to insulin or doesn't produce enough. This type is often linked to obesity, a lack of physical activity, and genetic factors. Gestational diabetes, which develops during pregnancy, is driven by hormonal changes and insulin resistance, and it heightens the risk of developing type 2 diabetes later on. What happens if diabetes is left untreated? If diabetes is not managed properly or left untreated, it can lead to severe and potentially life-threatening complications. Key outcomes include 1. Cardiovascular issues. High blood sugar damages blood vessels, raising the risk of heart disease, heart attacks, and strokes. 2. Diabetic neuropathy. Nerve damage, especially in the legs and feet, can cause pain, tingling, numbness, and loss of sensation, which increases the risk of wounds and infections. 3. Diabetic nephropathy. Kidney damage may progress to kidney failure, requiring dialysis or a transplant. 4. Diabetic retinopathy. Damage to the eye's blood vessels can lead to vision problems and even blindness. 5. Diabetic foot complications. Poor circulation and neuropathy can result in sores and ulcers on the feet, potentially leading to amputations if untreated. 6. Skin issues. People with diabetes are more prone to infections and delayed healing. 7. Pregnancy risks. Diabetic women are at higher risk for complications during pregnancy that can impact both mother and child. 8. Oral health problems. There's an increased risk of gum disease and tooth loss. Fortunately, these complications can often be prevented or minimized, and at the end of this video, we'll discuss how. How can diabetes be detected early? Diabetes is diagnosed through blood tests that measure glucose levels. Common tests include the fasting glucose test, oral glucose tolerance test, and hemoglobin A1C test. If diabetes is diagnosed, your doctor will create a treatment plan that may involve lifestyle changes, medications, and regular blood sugar monitoring. Let's now delve into the 20 signs that could suggest you have diabetes. Stay with us until the end, because sign 18 is surprisingly common but frequently overlooked. Remember, these signs could indicate diabetes, but only a healthcare provider can confirm this through specific tests. Sign 1. Excessive thirst. One of the earliest and most noticeable signs of diabetes is excessive thirst, known as polydipsia. When blood sugar levels are elevated, the kidneys work overtime to filter out the excess sugar. If they can't keep up, the excess sugar is expelled in the urine, leading to fluid loss and dehydration. This dehydration triggers persistent thirst, even when large amounts of water are consumed. This cycle of thirst and frequent urination can be exhausting and disruptive, particularly at night, affecting sleep. Ignoring persistent thirst can lead to further health complications. Chronic dehydration can cause fatigue, dizziness, confusion, and in severe cases, hospitalization. Therefore, it's crucial to monitor this symptom and seek medical advice if you notice you're drinking more water than usual without an obvious reason. Sign 2. Frequent urination. Frequent urination or polyuria is closely tied to excessive thirst. When there is too much glucose in the blood, the kidneys attempt to eliminate the excess through urination. This process increases urine production, leading to more frequent trips to the bathroom, even at night. This can disrupt sleep and affect your energy and mood during the day. Additionally, the ongoing fluid loss can lead to dehydration, which in turn intensifies thirst. It's important to note that frequent urination can also be a sign of other conditions, such as urinary tract infections or prostate issues. However, if this symptom is accompanied by other diabetes indicators, it's crucial to see a doctor for proper evaluation. Sign 3. Persistent hunger. Persistent hunger, known as polyphagia, is another common sign of diabetes. When the body cannot effectively use glucose for energy, it sends signals to the brain that more food is needed, resulting in constant hunger, even after large meals. Polyphagia occurs because, despite high blood sugar levels, the cells are unable to access glucose due to insufficient insulin or insulin resistance. As a result, the body continues to signal hunger to obtain the necessary energy. This unrelenting hunger can lead to weight gain, especially if high-calorie foods are consumed to satisfy it. This can create a vicious cycle, as weight gain can further increase insulin resistance and worsen diabetes symptoms. Sign 4. Unexplained weight loss. Unexplained weight loss can be a sign of diabetes, particularly type 1 diabetes. When the body is unable to obtain energy from glucose, it begins to burn fat and muscle mass for energy. This can lead to rapid and unexpected weight loss, even without changes in diet. In type 1 diabetes, the body doesn't produce enough insulin, while in type 2, insulin usage may be impaired. In either case, the cells cannot absorb glucose from the blood for energy. To compensate, the body breaks down fat and muscle, leading to weight loss. This weight loss can be significant and rapid, and is often one of the first noticeable signs in type 1 diabetes. If you experience unexplained weight loss without changes in diet or activity levels, it's important to consult a doctor to determine the cause. Sign 5. Fatigue. Fatigue is a symptom that can be associated with a range of health conditions, including diabetes. When the body is unable to use glucose properly, it lacks the energy required for efficient functioning. This results in persistent tiredness and a feeling of being drained, even after adequate sleep. Fatigue in diabetes is caused by the cell's inability to obtain sufficient glucose from the blood for energy production. This may result from a lack of insulin, insulin resistance, or both. Additionally, dehydration from frequent urination can exacerbate feelings of fatigue. This fatigue can have a significant impact on daily life, making routine tasks and enjoyable activities more challenging. If you find yourself constantly tired without an obvious cause, it's important to seek medical advice to identify the underlying issue. Sign 6. Blurred vision. Blurred vision is a common indicator of diabetes. High blood sugar levels can cause the lenses in your eyes to swell, affecting your ability to focus. Sometimes this blurriness may be temporary, but if left untreated, it can lead to more serious issues like diabetic retinopathy. This symptom can occur with both types of diabetes and is often one of the first noticeable signs. Elevated blood sugar levels cause glucose to build up in the eye lens, leading to swelling and distorted vision. If blurred vision is due to diabetes, it can improve once blood sugar levels are controlled. However, prolonged high glucose levels can cause permanent damage to the blood vessels in the retina, leading to diabetic retinopathy and potential vision loss. Sign 7. Slow wound healing. Slow healing of wounds and cuts is another potential sign of diabetes. High blood sugar can damage nerves and blood vessels, hindering blood flow and making it more difficult for the body to heal. This can increase the risk of infections and more severe complications if not properly treated. Slow wound healing is a common problem for diabetics, and can affect both minor and major injuries. High glucose levels can impair immune cell function, making it harder for the body to fight off infections and heal wounds. Wounds that heal slowly can turn into ulcers, especially on the feet where circulation may be restricted. Foot ulcers can be challenging to treat and in severe cases may result in amputations. Therefore, it's important to monitor and care for wounds carefully if you have diabetes. Sign 8. Frequent infections. Frequent infections, particularly of the urinary tract and skin, may be a sign of diabetes. High blood sugar levels create an ideal environment for bacteria and fungi to thrive, increasing the risk of infection. Urinary tract infections are common in diabetics because elevated glucose in the urine encourages bacterial growth. Symptoms may include frequent urination, pain or burning during urination, and cloudy or foul-smelling urine. Skin infections, such as boils and abscesses, are also more common in diabetics. A weakened immune system and impaired circulation make it harder for the body to fight infections and heal wounds. Sign 9. Dry, itchy skin. Dry skin and itching are symptoms that can be associated with diabetes. Dehydration from frequent urination can lead to dry skin, and circulation problems can affect skin health, causing itching and increasing the risk of infections. Xerosis or dry skin is common in diabetics and can be worsened by factors such as hot baths, harsh soaps, and low humidity. Dry skin may cause flaking, cracking, and a feeling of tightness, increasing the risk of infections. Itching can also result from diabetic neuropathy, where nerve damage from high blood sugar causes intense itching, often in specific areas like the feet and legs. Sign 10. Tingling and numbness. Tingling and numbness in the hands and feet, known as neuropathy, are possible signs of diabetes. High blood sugar levels can damage nerves over time, leading to tingling, numbness, or pain in the extremities. Diabetic neuropathy is a common complication of diabetes and can affect various types of nerves, including peripheral, autonomic, and focal nerves. Peripheral neuropathy, which impacts the hands and feet, is the most common form and can cause pain, tingling, numbness, and muscle weakness. Autonomic neuropathy affects nerves that control involuntary bodily functions, such as digestion and bladder control, and can cause symptoms like digestive problems, urinary incontinence, and erectile dysfunction. Sign 11. Dark skin patches. Dark patches on the skin, particularly in areas where it folds, such as the armpits and neck, can signal insulin resistance, a precursor to type 2 diabetes. This condition, known as acanthosis nigricans, indicates higher insulin levels in the body. Acanthosis nigricans appears as dark, velvety, and thickened patches of skin, typically in areas where the skin folds or rubs together, such as the neck, armpits, groin, and joints. Although these patches do not cause symptoms beyond their appearance, they are a significant sign that the body is struggling to regulate blood sugar. If you notice such patches, it's important to seek medical evaluation and possible diabetes testing. Sign 12. Mood changes. Mood changes, including irritability and unexplained fluctuations, can be symptoms of diabetes. The energy deficits and hormonal imbalances associated with diabetes can have a significant impact on mood and emotional well-being. High blood sugar levels, hyperglycemia, can lead to irritability, anxiety, and depression, while low blood sugar levels, hypoglycemia, can cause nervousness, confusion, restlessness, and sudden mood swings. These changes can be challenging both for the individual affected and for those around them. Proper blood sugar control, combined with emotional support and therapy if needed, can help stabilize mood and enhance emotional well-being. Sign 13. Oral health issues. People with diabetes are more prone to oral health issues such as gingivitis and periodontitis. High blood sugar levels can encourage bacterial growth in the mouth, leading to gum and tooth infections. Increased glucose levels in saliva create an environment conducive to bacterial growth, impacting oral health. Gingivitis, which causes gum inflammation, redness, swelling and bleeding, can progress to periodontitis if untreated, damaging the tissues and bones supporting the teeth. Good oral hygiene, including regular brushing, flossing and dental checkups, is essential to prevent these infections. Managing blood sugar levels also helps reduce the risk of oral health problems. Sign 14. Swollen gums. Swollen, red and tender gums can be another indicator of diabetes. The condition weakens the body's ability to fight infections, making gum issues more likely. Gingivitis, the early stage of periodontal disease, can progress to periodontitis if untreated, damaging the bones and tissues supporting the teeth and potentially leading to tooth loss. Diabetics are more susceptible to gum infections due to impaired immune responses and elevated glucose levels in saliva. Good oral hygiene and blood sugar management are crucial for preventing and treating gum issues. Sign 15. Nausea and vomiting. Frequent nausea and vomiting, especially when combined with other symptoms like excessive thirst and frequent urination, may indicate diabetes. These symptoms can result from high blood sugar levels and diabetic ketoacidosis, a serious complication of diabetes. Diabetic ketoacidosis occurs when the body begins to break down fat for energy because there is insufficient insulin, leading to the production of ketones. These acids can accumulate in the blood, causing nausea, vomiting, abdominal pain, rapid breathing, and confusion. Diabetic ketoacidosis is a medical emergency that requires immediate treatment. If you experience these symptoms along with other signs of diabetes, seek medical attention immediately. Sign 16. Dry mouth. A dry mouth or xerostomia is a symptom that can be linked to diabetes. Dehydration caused by frequent urination can reduce saliva production, leading to a persistent dry mouth. This condition can be uncomfortable and increase the risk of oral problems such as cavities, gum disease, and infections. Saliva is important for neutralizing acids produced by bacteria, protecting teeth from decay, and aiding in chewing and swallowing. To manage dry mouth, it's important to stay hydrated, avoid alcohol and caffeine, and use alcohol-free mouth rinses. Sometimes, a doctor or dentist may recommend products to stimulate saliva production. Sign 17. Bleeding gums. Bleeding gums may suggest diabetes. Elevated blood sugar levels can impair gum health, making them more prone to infections and bleeding. This often occurs during brushing or flossing and is a common sign of gingivitis. If untreated, gingivitis can progress to periodontitis, a serious condition that damages the tissues and bones supporting the teeth, possibly leading to tooth loss. Good oral hygiene and blood sugar management are essential to prevent and treat gum problems. If you frequently experience bleeding gums, it's important to see a dentist for evaluation and treatment. Sign 18. Difficulty focusing. Difficulty focusing can be another symptom of diabetes. Blood sugar fluctuations and energy shortages can impair brain function, leading to concentration problems and memory issues. Both high and low blood sugar levels can cause neurological symptoms, including difficulty focusing, confusion, dizziness, and blurred vision. These problems can impact daily activities, work, and social interactions. To improve focus, maintain blood sugar levels within the target range, eat regular, balanced meals, and exercise regularly. Psychological support can also help manage the emotional challenges of living with diabetes. Sign 19. Frequent headaches. Frequent headaches can be a sign of diabetes. High blood sugar levels can lead to dehydration and changes in blood vessels causing headaches. Dehydration from frequent urination can constrict blood vessels in the brain, triggering headaches. Additionally, low blood sugar levels can cause symptoms like dizziness, confusion, and headaches. If you experience frequent headaches along with other diabetes symptoms, monitor your blood sugar levels and consult a healthcare provider. Staying hydrated and managing blood sugar levels can help reduce the frequency and severity of headaches. Sign 20. Unexplained weight gain. Unexplained weight gain, especially around the abdomen, could be a sign of type 2 diabetes. Insulin resistance may cause fat to accumulate in the abdominal area, even if you follow a healthy diet. Insulin regulates blood sugar by promoting glucose absorption by cells for energy. When the body becomes resistant to insulin, cells cannot properly absorb glucose, leading to high blood sugar levels and fat accumulation. Abdominal weight gain is associated with a higher risk of diabetes-related complications, such as cardiovascular disease and further insulin resistance. Maintaining a healthy weight through a balanced diet and regular exercise is key to preventing and managing type 2 diabetes. Preventing diabetes. These are the 20 signs that might indicate you have diabetes without realizing it. If you recognize one or more of these symptoms, it's crucial to consult a healthcare professional for a comprehensive evaluation. Remember, early detection is vital for effective diabetes management. Prioritizing your health is essential for a long and healthy life. Adopting a healthy lifestyle is crucial for preventing and managing diabetes. This includes a balanced diet rich in fruits, vegetables, whole grains, and lean proteins, regular physical activity, and maintaining a healthy weight. It's also important to avoid excessive consumption of sugar and refined carbohydrates, which can spike blood sugar levels. Treating diabetes. In addition to lifestyle adjustments, diabetes treatment may involve oral medications or insulin. There are various types of diabetes medications, each with a different approach to controlling blood sugar levels. Insulin is usually necessary for people with type 1 diabetes and may also be required for some individuals with type 2 diabetes. Regular monitoring of blood sugar levels is a critical aspect of managing diabetes. This can be done using a home glucose monitor, allowing you to measure glucose levels several times a day. Keeping a record of these readings can help identify patterns and make necessary adjustments to treatment. Managing diabetes also involves addressing other health conditions that may be affected by diabetes, such as high blood pressure and cholesterol levels. Your doctor may prescribe medications to control these conditions and reduce the risk of diabetes-related complications. Key tips for managing diabetes. Diabetes can lead to complications like cardiovascular disease, nerve damage, neuropathy, kidney problems, nephropathy, eye issues, retinopathy, and foot problems. These complications can be serious, but with proper management, they can be prevented or delayed. Education about diabetes is an important part of treatment. Participating in diabetes education programs can help you better understand the disease, how to manage it effectively, and how to make healthy lifestyle choices. These programs may be offered by doctors, nurses, dietitians, and other healthcare professionals. Emotional support is also crucial for people with diabetes. Managing a chronic condition can be challenging and can affect mental and emotional well-being. Seeking support from healthcare professionals, support groups, or counseling can help you cope with the emotional aspects of living with diabetes. Regular checkups are essential for monitoring potential complications of diabetes. These checkups may include blood tests, urine tests, eye exams, foot exams, and kidney function tests. Keeping a consistent schedule for health checkups can help detect and treat complications early. If you've been diagnosed with diabetes, it's important to follow the recommended treatment plan and make necessary lifestyle changes to manage the condition. This includes eating a healthy diet, exercising regularly, monitoring blood sugar levels, taking medications as prescribed, and attending regular health checkups. Remember, diabetes is a manageable condition, and many people with diabetes lead long and healthy lives. If you're concerned about diabetes symptoms, don't hesitate to consult a healthcare provider for a thorough evaluation. Early detection and appropriate treatment are key to preventing complications and improving quality of life. Thank you for watching our video. Don't forget to like, share, and subscribe to our channel for more informative health content. See you next time.